Hi, I'm Dr. Kate D, and this is another entry in my series of episodes about why I say no to people or what I talk people out of. And today I'm going to talk about laser hair removal in teenagers. This has come up a lot, and another friend of mine recently asked me about this question. How young is too young, and will you do laser hair removal on a teenager? And my answer to that is not 100% dogmatic one way or another. But the most important thing is, besides being a good candidate for laser hair removal, and that means having relatively light skin compared to the color of the hair, that's the ideal candidate. We can do people with darker skin. We do have the right laser for that. But this conversation is really about who is asking for this treatment. Is it the teenager themselves or is it the parent? And in my experience, there haven't been that many teenagers who've come to my office who they themselves really want to get rid of the hair, whether it's their legs or their armpits or somewhere else. Oftentimes, this is driven by a parent who's bothered by this hair and less concern about for the kid. Okay. So here's my take on this. Okay. If there's a teenager who's old enough to be aware of what the risks and the benefits are and has a parent who's supportive, so this person is underage, they need a parent to consent for them. Okay. So we're talking under 18. Okay. But they understand it. They really want it. There's a strong reason behind it. They understand that it might hurt a little bit, and the parent is supportive and they're wanting to do that. I think that it can be reasonable if that's what's happening. Okay. On the other hand, if it's a parent who looks at their kid and sees them as flawed and wants them to take care of hair they don't like, and the kid seems indifferent, the kid is not driving this, the kid is not asking for this, it's really they're just doing what their parent says, that is a big red flag to me. We will not treat that patient. That is not appropriate. I'm not going to call it abuse or whatever, but this is a little bit twisted to me. That's a big red flag. It's one thing for a parent to talk about the changes that come with puberty and hair, and it's a normal part of being human. And if the kid, doesn't like it and they're very young, that's life. They're too young to know or understand. But at some point, you're nearing adulthood. I have had not very many, but a couple of, say, 17-year-olds say, hey, can I do this? Is this a thing? I am a swimmer and I hate this hair and I'm shaving it all the time and it's very dark and I don't know, whatever. There's lots of reasons why people can reasonably want to get rid of underarm hair, leg hair, any other hair, frankly. And so it really is about informed consent. So in the case of someone who's a minor, it has to be informed consent with both the patient and the parent, but it has to be driven, in my mind, by the patient. And you cannot have informed consent if a kid is too young to understand it, or if a kid really is indifferent and they're only doing it for their parents, to please their parents. We won't do that. And that takes quite an extended conversation with both the parent and the patient. And that takes a lot of time and energy and education and judgment. And that's something that I do personally. And I think that, obviously I've talked about this before. I have a nurse practitioner and a PA in my practice, and they also will have an extended conversation with both the kid and the parent. And then they'll ask me if they're not sure, if they're like, you know what, I think this is the mom driving this. I don't think the kid really wants it. I will actually do a consultation myself to sort that out. And basically, I will take the responsibility for saying no. No, I'm sorry. And we may just say we just don't do anyone under 18. But occasionally I have had I can't think whether I've had someone younger than 17. There might have been a 16-year-old once. But, a 17-year-old who is very well aware of what the situation means to them personally, socially, either athletically, on their team, and they have very reasonable expectations, then I think that it can be reasonable, but it is for select patients only, and it has to be very carefully determined. And so that means that, it is not, the esthetician cannot decide this. This has to be a medical decision. And I know there are plenty of places who would just say no one under 18, and that is very reasonable. And so if you say no one under 18, very, very reasonable. And if you want to select certain patients over time, being careful and selecting those patients, that is also reasonable. And if you're a patient looking for this, I really would keep that in mind, because, if you are young and you think you want to make something permanent, a permanent decision, you may not be happy with that down the road, right? Now, I mean, do most people regret getting rid of hair in places they didn't want hair? Probably not. But it's really important consideration. And so that's what we look at. And so the vast majority of times, I will talk people out of it and say, look, when you are ready to do this, when this is something that is driving you and you're 100% sure you want it, then fine, let's go through with it. If it's just the parent wanting their kid to look different, no, we will not do that. That's just not okay. I think that's really important to understand. As a parent myself, my opinion of whether I think they should wear these clothes or do something with their hair or not dye their hair or dye their hair, you know what? That's not for me to decide. Hopefully, I have raised them to make their own really good decisions. And I have 3 adult kids now, so, you can go ask them. Anyway, so that is my take on laser hair removal in teenagers. We have done it. It can be very, very well tolerated and can really, really help some kids, especially if they have an extraordinary amount of hair in an unusual place that they really don't want. And they are 100% sure they want to get rid of that permanently. And a word about whether it's permanent or not. I mean, for the most part, it's permanent. When you kill a hair follicle, that is not coming back. Now, over time, your hair, your body recruits new dark terminal hairs. And so you can grow new hair in an area where you pretty much cleared all the dark hairs and you get a new one here or there. So people will need touch-ups over time. I know a lot of people call it laser hair reduction instead of laser hair removal. That's also true because let's say, you get rid of a certain percentage of the hairs each time you treat it. You're not getting rid of every single hair, every treatment. So, but in general, once you treat an area and the hair is gone, that's not coming back. So I can tell you, I treated my underarms, this is a number of years ago now. I got nothing there. There's no hair coming back there. So it is permanent. Okay. So it is a little bit of a semantic thing. But in any event, sometimes when you're a teenager, you might want a permanent thing and then later regret that. So we know that there's regrets about making permanent decisions about, but again, once you're 18 and you can make all your medical decisions, then that's up to you. And if that's what you want to do, then we're not going to do that because your mom wants you to. Okay. So hopefully that's clear. And that is my take on laser hair removal in teenagers. It's not a terrible thing, but they really, really have to want it themselves. Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.